Babies and reflux. So, reflux is very common in babies, and it happens for a couple of reasons. One is that because of their anatomy and the positioning of the esophagus, which is the tube between the mouth and the stomach, the placement, kind of positioning, is such that it makes it easier for babies to reflux or spit up. There is also a weakness initially, usually, to the muscle that holds food or milk in the tummy, and so it is just more likely to come up. This, plus the fact that babies do sometimes feed themselves a little more than they need to eat, can lead to that milk coming back up. And it is not uncommon. It can be kind of annoying. It can wake a baby up. It can cause a lot of extra laundry. But generally speaking, we as pediatricians do not worry a lot about reflux if it does not seem to be affecting your baby's weight gain. So it can affect weight gain in the sense that babies can eat less because it's uncomfortable for them, or that they are spitting up so much they can't even keep down enough to gain weight. So that's one thing that bothers us. And the other thing is if it does seem to hurt the baby. Most of the time, most innocent baby reflux is fairly effortless and does not seem painful. May in fact be that the baby even feels better afterwards if their tummy was a little too full. So those are the general things that we don't worry about with reflux, or that we can be reassuring if those things are not happening. And that is called baby reflux. Now, there's also reflux disease, or gastroesophageal reflux disease, or GERD. And GERD is when you do have these other problems along with it, and it is something that needs to be treated in some way. But if the reflux is benign and not causing any actual problems in your baby, then a few things can help. One is if you do have a baby that is a very eager eater, you want to just give them breaks, and, more breaks for burping and just resting, catching their breath a little bit before they go on with a feeding can be helpful. If you are bottle feeding, then using a slower flow nipple and holding it more horizontally, or doing what's called paced bottle feeding, helps babies to take in less air, which may help. It also helps to prevent overfeeding a baby, which if your baby does eat a little bit more than they can really fit in their tummy, it's going to come up. So if your baby is refluxing a lot, then just cutting back a little bit on the volume that you're giving your baby can help. That's harder when a baby's breastfeeding, but if you're using the bottle, you can cut back by a half an ounce or so and see if your baby refluxes less. Now, granted, they may then eat a little bit more frequently in order to make up for that slightly lower volume, but it may help with the reflux. Another thing is just holding your baby a little bit more upright for 20 to 30 minutes after feeding them. Now, of course, there's times of the day or night in particular that you may not want to do this. So again, if it's not causing problems, then pros and cons, you got to decide what's more important: a little bit more sleep for you and not having your baby reflux, or allowing your baby to reflux a little bit. So babies actually on their backs are less likely to aspirate than when they are on their tummies. So people worry about babies with reflux sleeping on their backs, but it's actually still the safest position. So there are some significant problems that can be associated with babies vomiting or spitting up large volumes. So the real red flags to look for are if your baby spits up something that doesn't look like milk or just stomach acid. So if it is bright green, like lime green, or if it is bloody, or if it is black, those are all red flag for something more serious. The other thing is projectile vomiting. So when I say projectile, I mean like exorcist style, hitting the wall across the room, basically. Just plain reflux can sometimes be a little bit forceful. It could be like a little fountain. It can even come out of the nose sometimes, and that can be a little bit bothersome to a baby just because that is uncomfortable no matter what. But again, some of those other tricks can sometimes help with that. Now, if it's a real problem and your baby is sick or there's something going on, then those things are not going to help, and it's going to persist and probably worsen, and your baby then may not want to eat as much. Or if they are vomiting large, forceful amounts every single feeding, then those are times that you do need to reach out to your physician. So hopefully that's helpful. Just my main point is that most reflux in babies is fairly normal. They do grow out of it, usually over time, but it is something to discuss with your doctor if it's happening so that they can help you also to make sure that there aren't any red flags, and to check your baby's weight because you may not know whether or not your baby is gaining weight okay. So hopefully that is helpful. If you are looking for a pediatrician or a breastfeeding medicine specialist in the Chicagoland area, particularly the western suburbs, reach out to me at intouchpediatrics.com.